and I'm sure what I'm going to say here is not going to be pleasing to a lot of people. There is no safe level of alcohol.
So the last question is there is a safe limit for alcohol consumption? And is fatty liver is something that we should worry about?
Yeah, so I'll take this as two separate questions. And I'm sure what I'm going to say here is not going to be pleasing to a lot of people. So there is a reason why the World Health Organization last year made a statement that there is no safe level of alcohol. Right. So, time and again, when somebody says alcohol, the first thing that comes to our mind is the liver. Right. And the second aspect of that is that, your liver is safe if you take occasional alcohol, if you party a bit once in a while, it's fine. Only if you're a drunkard, you have been like in the movie Spirit. If you're drinking like that, only then your liver gets affected. So as long as I'm not that drunkard, I'm fine. So these are all the myths that WHO completely busted with that statement. The reason why we say that there is no safe level of alcohol is because even the lowest dose of alcohol, as much as even a single drink per day or a single drink, can actually increase the risk of various types of cancers. And there are 21 types of cancers that can actually be directly associated with and linked with alcohol consumption. And the most important is breast cancer in women and pancreatic and blood cancers in men. So I think it's very important for us to understand that it's not just about the liver anymore. Alcohol use affects the whole body from head to toe, and the most important of that is the increased risk of cancers. It's not cirrhosis that we are talking about here, it's cancers. So you can actually see that a lot of people drink, right? I mean, a lot of them drink, but none of them actually, all of them actually get cirrhosis. But you can see that a large proportion of these patients do develop cancers. And if you drink one glass of wine, that one glass of wine can reduce your brain volume. That is known as brain degeneration. That happens with a single drink. And if you have occasional drinks, so there are people who drink maybe twice a week or once a week, but they drink every week, right? If you keep doing that, then your brain degeneration becomes much more and more. At some point, you will realize that you are not able to focus much. Your memories are affected. You are not able to make new memories. So this is how the brain also gets involved even with the lowest dose of alcohol. So alcohol use is not just about the liver anymore. It's about cancers. It's about the brain health. It's about the heart health. It's about the gut health. All of this is impacted. And most importantly, previously what was once thought that a glass of wine a day actually is good for your heart. I'm really astonished to see even cardiologists at this age and at this time, at this day, say that people can have one single malt and it is fine, it is good for the heart. And this is completely wrong, because the American Heart Association and the World Heart Federation has done the largest study on this and showed that even the lowest dose of alcohol can actually increase chances of heart attacks and myocardial infarction and sudden cardiac deaths, and also arrhythmias, which is basically disease affecting the rate and rhythm of the heart. All of this happens even with the lowest dose. So there is no safe level of alcohol. Safest
Yeah.
level of alcohol is 0.